I was gonna punch you earlier.
Home run.
Whoa.
Do you want the truth, or do you
Yes.
want to go back to the life you were living?
I want the truth.
Let's do it.
Ah! Ah! Oh gosh!
That was a home run. Gotcha. Gotcha. That's it. Gotcha. Gotcha. Welcome to the office. I want to go over a few things. We already went over her history as to why you're here. And she's coming from Italy, from Sicily, and she's had a few issues in her spine. And as I said, I've already done the consultation history. We had to have a translator on FaceTime. Okay, so we had a few challenges, but we got through it. What I want to go over is the findings, what I found on the x-ray, and we're going to watch her walk. After the walk, we're going to do your exam. We're going to figure out where we're going to start today and give her her first adjustment. From what we discovered, right, there was an issue when she was born, and the doctors pulled a little much, and there was an issue with the arm, right, the shoulder and the neck. You've developed a curvature issue in your spine, yes? So there's back issues, there's hip issues, there's neck and shoulder issues, right? I'm sorry, let me sit down. So why don't we watch you walk? Okay, I'm gonna watch you walk, and then I'm gonna say what I see, and then we're gonna go over the x-rays, okay? Stand right here. First thing we wanna do is look at the dimples. We can, like, this is your stand, right? This is how she stands? This is how normal stand?
Yes.
Yeah.
Okay, so look, this is up high, down low. She stands like this. We need to balance this out. Go ahead and walk back and forth, okay? Go ahead. Regular walking. Is this how she walks?
Yes.
Really? Turn around, walk towards me here. This is your walk?
Questo è il tuo
Okay, it's
camminare?
okay. It's okay, don't worry. Turn around, please. Good. Turn around. Good. Perfect. Walk. Stop there. March in place, like this. Okay. My hand is here if you need it. Okay. Look straight. Okay. Now, close. I'm gonna let go. You march. March with me.
Marcio con lui.
And then I'm gonna have her close her eyes. I'm gonna hold right here. She's not gonna fall. Close your eyes. Keep
Chiudi gli
marching.
occhi.
Keep marching.
Chi?
No. So, walk.
Allora,
March.
marcia e chiudi gli occhi.
Ah.
Okay.
Vai.
March. Close your eyes. Good. Open your eyes. Close your eyes. You can see how the feet are she's completely trying to keep her
Yeah.
balance, right?
Yeah.
She's going back and forth, left and right. Okay, come over here and have a seat, please. Good. Let's go ahead and scope her. You come over here. And the first thing is, what are some of the things that we see? And the first thing is, let's look. So you can see there's a crease here. There's no crease here, right? Because the spine is like this. You can see the right shoulder is higher here, the left shoulder is lower, the right shoulder comes back, the left shoulder goes forward. Yes?
Yes.
Okay. Now, let's look at the bottom. Now, let's look at dimples we said here.
Yes.
Now, we need to check the motion of the dimples, okay? We need to see how they're moving. We're gonna check first, let's go ahead and scope her. And let's start here at the base of the neck. Starting at the base. And the first thing we're going to see is left atlas, 18 points. Right? 20 points there. See one on the left. See one on the 18 points left. Can you see this? You can sit up here if you want. You can come up. Okay? I want you to be able to see it. Número 1. Número 6, estómago. Stomach. Now, we have to follow the contour of the spine because it goes this way. So we're following the contour all the way to the bottom. Now, when we get to the bottom, here's where it goes left, but the lower down we go, it goes right. So remember I was showing you those two issues. Down low, S4 sacrum, up top, S1. Two issues. Okay, so we have, and that's what we need to figure out. So we have sacrum, we have around T6, and we have C1. Those are the majors nerve-wise. Okay. Let's go ahead and check motion of the pelvis. Go, scoot forward, go front. Feet together, feet touching, and open the knees, close the knees. Okay. Like this. Open, close, open, close.
When you tell,
and then I say left side only, I say right side only.
Okay.
Just like in the video.
Okay.
Okay? Okay, open, open, close. Open, close. Watch my thumbs. Open, close. Right side only.
Solo destra.
Solamente derecho.
Destra.
Destra. I know Spanish. I'm gonna learn Italian this week. So when she does the right, left wants to go with it. Destra.
Destra.
Left.
Sinistra.
Sinistra.
Sì.
Sinistra solamente.
Solo.
Solo. So when she does the left, the right is fine. Okay?
Yes.
Right side?
Solamente destra.
Yes. So you can see this whole, put your finger here. Mira, feel. You feel that? It moves. It's not supposed to.
No.
Now, let's do the right side.
Solamente destra.
Solamente left side.
Solamente sinistra.
Sinistra. Feel here. This side. It's okay. Just a little bit. It's not supposed to move. That's okay. This side doesn't move.
But it's here.
Don't worry about that. That's the result of here. We fix this, this gets better. Sit back for me, please.
That? What?
Back.
Più indietro.
Okay. Now, we need to do static palpation. Head down, look down, round your back, round, round,
Giù.
round,
Giù.
round, round, giù.
Giù.
Now, as I run my fingers down the spine, as soon as we get, look, there. No. 1, 2, 3, 4, 5,
6.
6 or 7. More pain here or here?
Here.
This one
Yes.
or this one?
No.
This one. 7. 1, 2, 3, 4, 5, 6. Okay. Now, let's continue. Come on this side. Hi. L5, come back into extension, back all the way, back. All the way back. Back. Duele?
Ti fa dolore? No.
Dolor?
No.
Okay. Dolor?
No.
No?
Dolore. No, no dolore.
Dolor? Okay. See? Here.
Yeah.
Okay.
Non è proprio dolore, è fastidio.
No dolore, but
Tight.
yes.
Dolor. Aquí no?
No. Ah, io
She has had pain long time.
Yeah.
So she has a high threshold. If I do this to her, it's okay. If I do this to you, you feel it more. I have to push hard for her to feel. Okay?
Sì, deve fare più forte.
Okay, so we're gonna start down
Down.
No.
here, sacrum. aquí.
Ajá.
Problema
Problema? Dolore?
número 1, problema.
Yeah.
¿Sí?
Un po'.
Poco. Número 2, aquí.
Ti fa male? Cos'è? Fastidio? Dolore?
Non è dolore.
No, dolore, trust.
Just pressure.
Pressure? Pressione.
Just pressure.
Yeah.
Okay. So we have T6, we have sacrum, we have the pelvis. We have left pelvis, we have the sacrum. We're gonna go over this in a minute, okay? Now I wanna go check her neck. So we have C7, C6, 5, 4, 3, 2, good. Relax down.
Rilassati.
Duele. Dolor,
Ah, sì, yeah.
dolor. Right side,
mm,
poco.
Poco.
Sí,
Yeah. Ah.
sí. Duele. Okay. Let's test it out. Turn left, turn right. Look up, turn left, turn right. Yeah, that's all tight on that right side.
Ah, yeah.
Yep.
Dolore.
So, see this one more, mucho,
Yeah.
or this one more?
This one.
Up
Up?
Yeah.
or down?
Giù o sopra?
Sopra.
Up.
C1. C1, T6, sacrum, and left pelvis. Now, I want to go over the x-rays again, and I'm going to explain what I'm finding and the challenges and what we're going to do.
Ok.
Okay? So, let's look at the x-rays. I'm going to turn off the light. So, as we're going through, this is her x-rays she's presenting with, and we can see it looks like a pretty hard curvature issue in the low back, a somewhat scoliotic looking curve. Now, I want to go over the analysis of the low back because there are a few challenges we have to figure out here. When we're looking at the foundation here, let's look at it. We can see based on the analysis, we have a rotated sacrum on the right, we have an ASEX on the left, we have a slightly dropped leg on the left side, 3 millimeters. The challenge is this, that now I know she had a fall because of the listing. The way the pelvis works, it works like this. When it goes up, it naturally wants to go in a little bit because of that auricular surface. The surface, it goes up, it wants to come in. Hers goes up and out. That's a blunt trauma. If it was down and out, that's different. If it was up and in, that's also different. It's not to say they're all misalignments, but when we see an ASEX or a PIIN, I'm pretty confident that there was. Now, in this scenario, we have down in the low S4, we have S1, S2. We had a couple of falls here. We have a rotated pelvis and a rotated sacrum. So here's our challenge. If the sacrum is rotated right and I bring it forward, you can see all these vertebrae are already turned left. So if I bring that forward, it's going to make all those rotate forward more. So that doesn't sound right if we're looking at rotation. If we're looking at the pelvis, then we need to bring it down and in. If I bring the left pelvis down and in, it's going to negate that or possibly bring it down. But because the numbers AS6, EX6, they're the same number, they kind of negate each other, which means adjusting the pelvis will help the movement of the pelvis, but adjusting the pelvis will not affect that leg length inequality. It is under 7 millimeters, so that's fine. The research, according to Dr. Gonstead, under 7 millimeters, bueno, is good. Okay? So we have a left pelvis, we have a sacrum. Now in her scenario, I'm actually going to be starting low in the sacrum. I'm starting on her sacrum. That's where we're going to start today.
Ok.
We're going to do sacrum,
Ok.
Okay.
Ci farà questo.
We're gonna do T6 and we're gonna do C1.
E la mandibola.
Now on T6, let's find a listing here. And it's again very subtle. It's a PR-T. It's PR, but if I'm adjusting, I don't want to be adjusting into a convexity or a concavity. We want to adjust into the high side. Again, the challenge with her is it's rotated to the left. We can see some whitening, like some scar tissue. If I feel in here, you can feel this, yes? Yeah? You feel this? The dolor?
Dolore?
Dolor?
Dolore?
Poco.
Poquito.
Poquito. So she has a high pain threshold. And the reason I mention it is because they came in very excited, which I appreciate, thank you. But there's a lot of emotion here because you've been dealing with this long time. Okay?
Yeah.
So, are you ready?
Sei pronta?
Yeah? Okay. Let's get started. Okay, we're starting here on the gray table. Ready?
Yeah.
Can you come here? Go up, up.
Alzati, più sopra, più sopra.
Now,
Ora.
you're gonna hold here.
Yeah.
Okay?
Ok.
You ready? See?
Sì.
Okay, numero uno.
Aia.
Primero, numero uno.
Yeah.
Numero uno. Turn your head to the left. Left hand here. I'm a little cold. Okay. Come on this side. You want to see it, right? Head down, please.
Come è stato?
Poquito.
Ai.
Come over here and have a seat, please.
Yeah. Siediti.
I have to do more of the neck. Left hand up, we're gonna put the seat belt. You've seen my videos. You know seat belt.
Yes, of course. I see your video.
Left atlas. She's very flexible. Very down, down. Gotcha. Home run.
Wow.
Home run. Walk once. Different.
Yeah.
What happened? Che differente?
Che ti senti diverso?
Il collo più libero.
The neck, free, plus free.
But look how she's moving her legs, remember?
Yeah.
Sit, have a seat over here, please.
Siediti di nuovo.
Bueno?
Yes.
Good. Okay. Now I'm just rescoping before I continue, okay? Zero.
Zero.
Zero. You know what? I better rescope. I have a feeling T6 is going to be clear. Look. Zero. Oh no.
Zero.
Poquito.
Poquito.
All right, it's still there. Let's go face down back on the gray table. We're going to do her T6 and we're going to do the sacrum still.
Ok.
Okay? Yes.
Metti di là e faremo la 6 ora.
Why are you crying so much? They're very emotional, the Italians, aren't they? Okay? Hold. Okay? Hold. Number 6. 1, 2, 5, 6. And we're doing that as a PR-T. T6, PR-T. Home run.
Ai.
Good. Breathe.
Relax.
Breathe. Pull her ankles a little bit. Slowly. Pull. That's it. You ready?
Sei pronta?
Mhm.
Deep breathing. Respire.
Respira.
Exhale. Exhale. One more.
Un altro.
Good.
Ai.
Home run.
Un altro.
Perfetto.
Fatto.
Huh? What happened?
Oddio.
Just wait a minute. You're okay?
Yeah.
Come. Walk. Look, walk fast. Walk fast, look.
Wow. No,
Look.
don't see that.
Why are you crying? You're happy? Okay, as long as you're happy. You're happy. Good? Keep walking. So her walk is completely different now.
È un po' diverso ora, sì. Ok.
Siéntate aquí. I know español.
Lui sa lo
Up,
spagnolo.
up.
Alzati.
Good. Don't worry this right now.
Ok.
Don't worry about this. Number one is we make sure we got the pressure off. C1 is
No, 0, 0, 0.
0.
0.
Zero?
Poquito, poquito.
No,
Zero?
don't worry about it.
Okay.
Just wait. We're just
Only this one?
we have to follow the spine. No.
Laura, 0.
Bueno. Back towards me. Back.
Indietro.
Less tight. Tight.
Fastidio?
Here.
Yeah.
Okay, no problem. I'm not worrying about that. That is gonna more walking, lots of walking. This is gonna get better.
Se cammini di più,
Ok.
questo così farà.
Okay? Good. Now,
Ora.
shoulders. Shoulders. Over, around, down. Gotcha.
Ho paura.
Over, around, down.
Down, giù.
That's it. Ears. Go on your back. Boca arriba.
Faccia, pancia di su.
Scioccata.
All right, now the ankles.
Ai,
Ay, dolor. Sí.
Dolore aquí.
Sí, dolor. Now,
Ora.
oh yeah. Let's work out scar tissue. So I'm gonna be working out swelling scar tissue. And she's Italian. She'll make noise, but she's can handle it. Ay. Ay, sí.
Ai.
Now, please, I know it hurts. Is it dolor?
Yeah.
Okay.
Dolor.
As much as she can handle it, though. Okay. Okay. 1, 5 more. 4, 3,
Devi
2.
stringi i denti.
That's it. Passive range of motion. She's got a AS talus medial tilt. We're gonna set it right now. Help me. come, hold. Okay?
Yeah.
And then when I count to 3, 1, 2, 3, you
Yeah.
raise it up, okay?
Up.
Hold on. Here, hold here. So 1, 2, 3, you go like this.
Oh, okay.
Okay.
1, 2, 3.
Hi! What's up? How you doing? Hold here. 1, 2, up. Let go. Let go. Let go.
Let go.
That's it.
Oh, let
That's
go.
it. That's it.
Okay.
That's it. That's it. Woo!
Wow.
Stand up, please. Up. Turn. Now, here's what I want us to do. Stand up and march in place. Stand right here and just
Marcia.
this way. Easier. Yes. Walk one last time back and forth, please, and have a seat. How is the walking? Better?
Yeah.
Let-
Better. Meglio?
Sì. Yeah.
Yes, it's better.
How's your hip?
Yeah.
Same?
È
Better?
simile.
Sì.
O te lo senti diverso? Ancora diverso? Te lo senti? Different or similar?
Eh,
Sit on the floor against the wall. Sit down.
Siedi?
Like this. Sit. Yeah. Sit down. Now, a good test, stand up, should be easier.
Ok.
Should be like
Se ti alzi e vedi che è
Stand up.
meglio.
Yeah? Now the machine, the buff and pop. Squeeze my hand. Squeeze.
Devi stringere.
Devi stringere?
Stringere.
Stringere. Squeeze. 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 Just strong. Elbow. What's this?
intervent. One intervent.
We need X-ray to see. Squeeze. Squeeze. What? Relax there, down. So we need to figure out what happened there too. Have a seat, check the jaw. Ah, close, slowly open.
Slowly, piano. Vai, apri e piano.
Look, open, close.
Close.
You see it goes this way. The problem is here. Dolor?
Yeah.
Dolor? No.
No.
See, we have a left jaw issue.
Lo sapevo. I know.
Problem. Okay. Now, she's gonna slowly close.
Piano, devi chiudere. L'ha fatto.
Non lo so.
L'ho fatto. Open. Yeah. It's okay. Okay, one more.
Com'è?
What?
Better.
Yeah.
Right? Good. Stand up, please. Squeeze again. Squeeze hard. Good. Squeeze. That's where we're gonna start, okay? Questions for me?
For this.
We need an X-ray. I need to see what this looks like first. So I'm gonna send you to tomorrow for X-ray for your elbow.
Ok. Ok,
Okay.
farei le raggi X e poi dirò.
Okay?
Ok.
So your homework is walking 1 hour every day or more.
Ok.
Ice, hielo, ice, In the back?
Ghiaccio. Yeah. Ice. Ghiaccio.
Ghiaccio. Okay, not gazpacho. So you got ice there and water. Agua.
Yeah.
Okay, agua. 2 liters a day.
Okay.
It's a lot of water, but you guys are going to be walking a lot.
Okay.
Okay? And I'm going to give her something to use. You're wearing walking shoes or
Yeah. Sì.
tennis shoes while running walking shoes?
Yes.
Okay, so we'll follow up with you tomorrow.
Tomorrow.
Okay?
Thank you so
Welcome.
much.
Welcome to the office.
Thank you.
You guys came a long way. I know you're very excited. So we got some work to do, okay? All good. Okay? All right. When did this start?
Like Friday night and midday on Saturday.
Okay, so you were kickboxing Friday?
Yeah.
And what about Thursday?
Thursday was soccer, but it was the pain. I didn't have pain.
So you don't normally get any of this from soccer?
No.
Okay.
On my neck, no.
Okay. And then, so kickboxing, did you recall a particular thing you did that started to hurt, or it's just started to hurt the next
It
day?
just started to hurt. I'm not sure if something.
What I'm thinking is it's more about maybe many punches that he was being thrown at the same time. I think the session went longer than usual
Okay.
because he's been doing it for a while.
Okay.
So basically, there's like, all right, instead of 100 punches, now you went to 150.
Now, is that the bag, or is this sparring?
Sparring.
Got it,
Sparring,
okay.
Yeah. So
Okay. And were you losing any power as the practice was going?
No, it was it was same as usual.
No change, no
Like no
difference?
change, yeah.
Okay, because the nerves that come out of the neck
mhm.
are the ones that control the chest and the arms. All of this is powered by the nerves here.
Okay.
That's why I wanted to know if there was he getting weaker towards the end or not?
I think I was just more tired.
Just tired, okay.
Yeah.
No pain in the hands or arms?
No, there's no pain.
Nothing in the back, everything is here on the sides of the neck?
Yeah.
Right.
Down
Both
to
sides
the
of the
shoulder.
Okay, got it. Now, that was Friday night. What happened Saturday and Sunday? Did it get any better, stay the same, or was it getting worse?
It got worse on
It
Saturday.
got
and
worse on Saturday. And were you playing soccer on Saturday?
No, but I had a game on Sunday.
You had a game on Sunday, but you were able to play, no
Yeah.
problem? You just
Yeah.
had to deal with it.
Yeah.
Okay, all right. Anything else I need to check?
No, that's the
No other
that's the main.
complaints or issues?
Nothing.
Okay. And I need you to scoot back for me. Scoot back? There you go. Okay, and I want you to sit how you would normally sit, okay? All right, so here's some things I want you to see, Dad. Okay, look, I'm gonna straighten this out too. So his pelvis is completely off. Look at this, this is the dimple here, feel.
Mhm.
Put your fingers here, put your finger on top of mine, that's the pelvis there and there.
Okay.
Okay,
Mhm.
now sit up straighter, straighter. So this whole thing is puffy. Do you see that?
Right.
It's not supposed to be like that.
Okay.
So this is actually starting as a sacrum, a tailbone issue. I'm going to show you on the meter. I'm going to get here, don't worry.
Mhm.
But I examine the whole spine to see what's going on. And remember, things down low can affect above and vice versa. There are 24 bones. Now I'm explaining all this. I want you to listen to what I'm saying as well, okay? You got 7 bones in the neck, cervical, cervical, C1, 7, 12 in the mid-back, thoracics, 5 in the low-back lumbars, and then you got the sacrum.
Okay.
Sacrum is consisting of 5 tubercles that fuse in our 30s.
Okay.
So there are individual bones here. What I want us to check also is his pelvis, because the dimples are off. This dimple is low, this dimple is high. This butt is smaller, the cheek, than this side, because the pelvis is also off. This stuff, he's an active kid. He's not feeling it, he's running through it. But he's going to tell you after the adjustment what's different. Okay?
Okay.
He's going to tell you.
Okay.
Now, let's follow the mechanics. Look, it's off here in the foundation.
Uh-huh.
So this is the foundation of the building, right?
Correct.
The foundation is not level. What happens to the rest of the building is compensating.
Right.
So the pelvis is high on this side, okay? Now, he's compensating by raising the left shoulder. Look. This all compensation because of the right pelvis.
That makes sense.
Now we're going to get to the neck, okay?
Okay.
All right, now, relax. Okay, head down. So, look there. You can see the bumps here, right?
Mm-hmm.
That bump doesn't look right to me. It kinks off, and then the bump straightens.
Okay.
I want you to see this though. So,
Oh, you're right.
okay,
Mhm.
it's right there.
Yeah.
Okay?
Mm-hmm.
All right, and we continue up. Stand up for me, please. Stand up. Take one step forward. Dad, I want you to see this from behind,
Okay.
please. Come back, please. Back towards me. Okay, just hold this. And now, so if we're correct, right pelvis
Mm-hmm.
higher, flatter.
Okay.
Okay?
Okay.
Causing an external foot flare in that right foot. His right foot is like this. Now,
Okay.
just to test it, march in place. March in place, knees up high, good. Now, I want you to close your eyes and keep marching. Just follow my instruction, please, okay? You're doing real good. Your eyes are closed?
Yep.
Keep your eyes closed and then stop. Okay? Now, I'm just opening the back here.
Okay.
Is it easier for you to put your foot out there like you just did?
Yeah.
And stop. Okay, march in place. You see, he wants to do that all the time. Do you see this? Okay?
Yeah.
I want you
Okay,
to see
that's-
this.
yeah.
This is important
Right.
because the short leg is on the left side, so he tilts like this. He has to bring this foot out in order to balance.
Okay.
Okay?
Right.
That's what I want us to see. All right, have it. Now I want you to walk a straight line this way, back and forth several times. This is our line.
Well, he's a defense and I'm a striker.
Okay, fair enough. So you guys are good teams then,
Yeah.
teammates then, yeah? Keep walking.
And we go to the same school.
Nice. Okay. This is starting in his right pelvis.
Yeah.
If you want to come over here, you can see. He's always going this way,
Going
and
through.
he's catching
Right.
himself.
I
okay?
saw that right leg kind of like.
You see that tilt out,
so
right?
Like, it's like,
So if you look at his shoes, he's going to wear more on the back right side.
okay.
Back right outside is where most of his wear pattern is going to be. And what you can do, you get a new pair of shoes today. Okay? You get a new pair of shoes after today.
Then I bought new shoes yesterday.
And you did?
Yeah.
Perfect. Okay. Those are going to be your new ones. And what you're going to see, the wear pattern will change. You'll see. Have a seat. And the brain sends the signals down the spine through those nerves. And these nerves are what control every part of your body, right? So in terms of the neck nerves here control the shoulder, control the arms. The nerves that come out of the low back are for your legs, okay? When these things misalign and they cause irritation, they don't go back in place, they cause inflammation. So what we're looking for is inflammation, and this is what I wanted to show you. So I'm going to run a meter on your back, your dad is going to watch. When we get to a hot nerve, it's going to go to the hot nerve. And then we pass the hot nerve, it's going to come back to zero. That's going to tell us where to focus the exam. Okay? And head down a little bit. So just on the visual, something doesn't look right here around C6. C7 is probably going to be his VP. And yep, there it is. Dad? Goes to the hot nerve, comes back. And it's interesting how it happened to be right where that kink is. Right?
Yeah.
Okay. See? Now let's check the rest of you. And if I don't do his pelvis, his low back, that's not going to hold, by the way. So we're going to do this and that today. Scoot forward, please. Feet together, sit up straight, feet touching. This is how he should be sitting. This is normal, but he's fighting, right? To sit like this.
Yeah.
Yeah. And what's going to happen is it's going to hurt to slouch when once I fix this up. Okay, feet are touching, open and close your knees. Open wide, close. Open, close. Open wide, close. Faster. Left side only. The right wants to go with it. Right side only. Left is fine. This is a right pelvis issue. Is it tender when I push in here?
Yeah.
Yeah. Is it also tender when I push in there?
Yeah.
Okay, so he's got sacrum and pelvis. Let's go ahead and do a Gonstead leg check and we'll figure out where we're gonna start. So the idea is right side is short. Do you see that?
Right. Okay.
Now we're gonna bend 90 degrees. If it stays short, we're doing sacrum. If it goes even or long, we're doing the pelvis today.
Okay.
Okay? Now, stays short.
Mm-hmm.
Look here.
Yeah.
Right?
Right.
Okay, so we're gonna start on the sacrum today. Sit up straight, all the way back, and let's motion the neck. Now, nice and easy. That's 7. Tender.
Yeah.
More tender there.
Yeah.
That's 6. Okay, let's go back slowly. He's already guarding there. That's 6. Bend right. That's 6. Bend left. Doesn't want to do it, does it? Max?
Yeah.
Pain, more pain that way
Yeah.
or that way?
Or to the right.
More pain when I go to the right?
Yeah.
And you feel the pull, right?
Yeah.
Now what happens when I go to the left? Do you feel pain here or a pull here?
Feel a pull right here.
So it's more of a pull on both sides.
Yeah.
So the muscle is guarding that area for C6. Okay, not a problem. Now, slowly turn your head to the left. You understand everything I'm explaining, Max?
Yeah.
Good. If you have any questions, it's not just about your dad understanding, it's about you understanding, okay? It's very important. Okay. Any questions for me, Max?
No, not yet.
You've been adjusted before?
Yeah.
Oh, you have? Okay. Is that okay for you, Max?
Yeah, it's good.
I gotta keep it a little firm. One second. There you go. Nice and easy there. There it is. Dad, why don't you come help because he's pretty flexible. Come on this side here.
Okay.
Stand here. Put your arm exactly the same as the belt. There you go. There you go. And it's just to hold him better. Nice. You ready there? Almost.
Ah.
Gotcha. That's it. That's it. You okay there, Max?
Yeah.
That was the worst of it, dude. Beautiful. That was a home run. Okay, move your head all the way back.
Actually-
Don't twist it yet. All the way back. That should feel better.
Yeah.
It felt good. It sounded. That sound felt good.
Now, here's the good test, right? Bend left. Bend right. Excellent. Less pull.
Yeah.
Still tight, but it's less. Now, watch this. Walk once, come back. Let's do your sacrum. The hard part's over, Max. See that puffiness? I want you to see that. And let's see what happens after the adjustment. Tuck the bottom butt cheek forward. There you go. Now, can you go to a happy place? If I drop you, I'll send you and the family to Hawaii. How's that? So don't try to fall though, okay? Don't try to fall. But I need you to let me roll you the best. Oh yeah, there it is. You okay?
Yeah.
Okay, I'm gonna roll it. Nope, leave the bottom leg. I got you the whole way. I won't let you drop, okay? So I'm gonna do it as a push today. There. Home run! Ah! Awesome. Walk it off. Tell Dad, not me.
I feel like straight, and more straight.
Mm-hmm. Have a seat now. Let's see how he sits. Dad?
Also, that was.
It's already a little different.
Yeah.
Now, sit up straighter. That doesn't hurt as much, does it? That's how he's gonna be.
Okay.
That's how we need to get him, okay?
So this is the
The sacrum,
the
tailbone.
right. And once this is off, then the whole.
It throws everything
Right.
off. Absolutely. So this started here,
Okay.
okay? Now, you can already see the butt is getting still smaller, but it's a little different.
Right.
Now, Look at the shoulders. Okay. Cool. Nice. Let's recheck. So that's the other thing. Yeah, that's clear. You see that, Dad? You remember?
Mm-hmm. Mm-hmm.
It's clear. Home run, people.
Nice.
Home run, sir. Now, go on your back. Tender in there. I know it's tender because I know you sprained that ankle before. I was saving this for last. There you go. Dad, help me with this. Come over here. Hold him like this. Face me. There you go. Now, wrap your fingers underneath. Okay? Don't do this.
Mhm.
We're going to lift.
Okay.
Lift. Hold it up. You give me your ankle. Let it go. There. Now you're going to pull slowly towards you. 1, 2, 3. That's it. Poquito más. That's it. Plus. That's it.
Yeah.
That's it.
Oh, that feels better.
Yeah.
Feels looser.
Wow.
Walk it off. I'm letting him tell you, okay, Dad? Tell him everything that's different now.
It feels like less tender.
Less tender on the ankle.
Yeah,
How's the back feel?
it feels better.
How's the neck feel?
Yeah, it feels less stiff.
Is it still stiff though?
No.
Squeeze my hand. Squeeze hard. Squeeze hard. Squeeze. Squeeze. Okay, let me set the elbow. Relax. And the thumb.
Whoa.
Let me set the elbow, thumb, and the wrist. Turn this way. This one's bonus.
Ah.
That's going to give you more balance, coordination, and listen to your dad and mom.
Thanks, Doc. Appreciate it.
You got it.
Thank you very
Come
much.
check with
Everything.
me, please, end of the week.
Okay.
Just for a follow-up.
Okay.
See how he did. He did, I'm pretty sure. Let's walk one more time, just to recheck. Right now is sleeping on your back. Don't sleep on your stomach, please. Ice the areas that I adjusted. So here and there.
Here.
Lower back.
10, 15 minutes on. One session. If you want to do a second one, you can. If you're going to be playing. This week, are you playing?
Yeah, I have a game at the end of the week, and I also have 2 practices during the
Okay.
week.
After practice, so you're going to ice in the morning before school. And then the day you have practice, you're going to ice at night when you get home. Okay?
Okay.
Just to make sure things hold better.
Okay.
Close your eyes. Stop. Open your eyes. Turn around now, please. And stand on your right leg. This is also homework. Standing on one leg for 2 minutes each side.
Okay.
Every day. Easy stuff. Watch TV, whatever.
Okay.
Other side, please. Stand on that. This is going to help with proprioception in his ankles. It's going to help stabilize the back.
I don't remember spraining my ankle.
You did. They'll tell you. That right ankle, you got clipped or something happened. Pretty good. Okay?
Thank you.
Questions?
No, then.
Okay. Enjoy your week. I'll see you Friday or
Thank you.
Saturday. Okay?
Hi,
Welcome to the office.
thank you.
Tell me what brings you here.
I have had back pains for I'd say maybe like 10 years.
Okay.
It's kind of been since I was younger.
What happened?
I think a few things have happened. I've been in like 2 car accidents that were pretty rough.
Okay.
And then I've been hit on my bike by cars 3 times.
Okay. So tell me about the first major fall or trauma or
Um,
accident.
I think the main one was maybe 6 years ago. I was hit by a car that was coming like 70 miles an hour at me, and I sit really close to the steering wheel,
Okay.
but it came right behind me.
So you drive like grandma?
Yeah, but
Okay.
everyone makes fun of it.
Alright.
But I didn't get hit by the car because of it.
Nice. Okay.
But I was spun
Good,
around, and then
good.
someone had to pull me outside of the car.
They use the jaws.
They did not know. Some
Okay.
stranger pulled me out of the car, put me on the side of the road, and then left.
Okay.
And then I was
Nice.
smart because I was like, I'm not going in an ambulance because that's $5,000.
Oh wow. Okay.
So I had someone drive me.
Got it. Okay. That was the most recent.
That was the most recent big one.
Okay. What was the big trauma though in your low back?
I don't really know exactly what it is.
Okay.
I was in a car accident when I was little. And then I've just kind of always had this pain, but I can't like pinpoint in my head what exactly it is,
Okay.
which is kind of frustrating.
Okay.
So,
What are you doing here?
I'm here.
You're here for back pain? You're here for your whole body? What are you doing here?
So I'm here for back pain, for neck pain.
Okay.
Basically, I can't sleep through the night because I wake up in pain.
In your low back or your neck?
I would say primarily in my low back.
Okay.
So I feel like I have to constantly be bending it and twisting it.
Okay.
And then I always feel just tense, like
Do you
almost
feel
robotic.
it on one side more than the other?
Recently, it's been my right side.
Before that was left?
It was general.
General. Does it shoot down your leg?
No.
Any shooting pains down your leg? Any numbness? Any tingling? Any of that?
No, not that I.
Okay. No?
No.
Okay. It wakes you up every night?
In the last year, it's been about every night.
Okay.
So
And that's
time.
number one?
That
Or low back?
I'd say lower back, my neck and upper. I broke my collarbone when I was a kid.
Okay.
So I don't know if something just has been weird with my neck, and I don't know if that's associated to it.
Okay. We'll take a look at it.
So my neck has always been an issue.
So how many accidents have you gotten in? This is the thing, because I need you to understand something. I don't believe in accidents. I believe we attract it.
I recently fell. I was on a hike, and I've been having knee pains, and I'm
Okay.
running a marathon in 20 days.
So you're able to run a marathon?
I've run 4 in 2 years.
So how are you dealing with all this if you're in so much pain? You
I say it's fun,
got it. So pain is your fun story now.
apparently.
Okay. All right.
Yes.
Right ankle,
No.
left ankle,
No.
left knee.
Yes.
One more time, left knee.
Yes.
Okay. You twisted it,
I fell on my kneecaps on rocks.
both of them?
Both of them. This one has the cosmetic, but this one, and I've been to a bunch of doctors.
Tender
and
in the back here?
yeah.
Okay, how
And-
about back here? Nope.
No.
Okay.
And I've been to acupuncture, and
Okay.
everyone's just like, we don't know.
Okay. But it still hurts.
Oh yeah.
And in terms of back pain, neck pain, what have you been doing? Into a chiropractor?
That.
You're self-adjusting?
Yeah.
Okay, so you have a lot of hypermobility then.
Yeah, and I'm hyperextensive in my elbows.
Got it,
So
okay.
they do this.
Whoa. That's kind of cool.
Yeah.
What's that tattoo of?
It's an airplane.
What kind of airplane?
It's a 1920s airplane.
Interesting.
Yeah.
Looks like one of the ones Gonstead used to fly. Gonstead was a pilot.
Oh, really?
Flew a plane like that.
Huh.
Yeah.
That's what
Did-
this tattoo
did-
is.
We're gonna put G-force on the bottom.
It's your new logo.
All right, so here's what we're gonna do. I'm gonna have you walk.
Okay.
All right, we're gonna watch your gait. As you're walking, we'll walk and talk.
Okay.
Okay, and then we'll do the exam and go from there.
Great.
Okay, go ahead and walk away. Keep going. So you're gonna walk several times back and forth.
Okay.
Keep walking. So we got a little bit of a waddle, not so bad.
Yeah.
They s-
They said,
The Minnesota waddle.
well, they said, is that a thing? The cardiologist
Yes.
said that maybe my knee fall was a blessing in disguise because my knees are hyperextensive, not as much as my elbows.
Okay.
But they said like maybe this is good to strengthen because when I walk, it's like they like
Got it.
lock in.
Your cardiologist or the orthopedist?
Orthopedic. Whoops.
I was like, you talking about a heart doctor
Yeah.
now. Walk on your toes, please, for me. Good. Turn around, walk on your heels. You can see that right pelvis just kind of sticks up on the right side. Okay, have a seat, please.
Another thing too,
Yes, ma'am.
when I sit like this, it starts to hurt like within 2 minutes.
Okay,
So I feel like I always need something that's like doing this. But
correct, because we need to get extension in your low back.
okay.
All right, so what's happening here, and we went over the films earlier, okay?
Uh-huh.
I'm not gonna be showing the films on this,
Okay.
but we went over the films earlier, and what's happened is there's a pretty serious situation going on in her sacrum over here. And it looks like down at S2, S3, there's a lot of posteriority. There was a bad fall there on the sacrum, on the tailbone, correct?
Yeah.
And she's just kind of been dealing with it all these years. And it's been there a while. It didn't happen just yesterday. Scoot forward, please. I'm going to have you touch your toes. Bend forward, touch your toes. And let's just get an overall look of the spine here. Not so bad going through here. We have a little dishing there, tender there.
Yeah, a little bit.
That one
Yeah.
or that one? Okay.
All of them.
All of it. It's a little dishing there. Come on up slowly, please. Let's run the meter on your back. Cool. All right, girl, you ready?
Yeah.
Let's do it.
This area right here
Mm-hmm.
feels like I always need to dig something in it.
This part here, right?
Yeah, like what it's like here, kind of.
So we need to talk about the sacrum. We need to talk about the lumbar spine. This is the major thing that we're going to need to address and correct in order to get you back to balance, okay?
Mm-hmm.
So a couple of things going on in the sacrum, but before we go there, let's talk about what we see on the meter. So we're getting a small, oh, there it is. Started out small. Started out balling, ended up hustling. Started out at 5, became 18. There we go. So we're getting about 17, 18 points of pressure on the left atlas. So what else? We're
Okay.
getting about 10 points around T4, 8 points. There we go. There it is. Let's continue through. Alright, let's continue all the way through. Mid-back is nice and clear. And now when we get down sacrum, now here's the thing. The meter is reading inflammation, right? This thing has been there a while. We're gonna find it there, but we're not gonna get a huge reading down here, like 20, 25. I don't see that, only because it's an old injury that's kind of been compensating over the years. So we got about an 8-pointer, 10-pointer, about an 8-pointer here, and we have about a 18-pointer up top in the atlas, okay?
Okay.
Let's go ahead and statically palpate. Are you starting to hurt sitting there, please?
It's okay.
You're okay?
Yeah.
All right. So let's static palpate. Follow my fingers. You can see right there the tissue changes, orange peeling. Right there. Tender.
Ah, yeah.
That's the one. That one.
Yeah.
That one. No. Starts
That one.
there, but that one
Yeah.
is sharper.
Yeah.
Head down, please.
What's that?
That's 7, that's 1, that's 2, that's 3, that's 4, that's T5.
Really?
T5, 6, 7, 8, 9, 10. T5 major nerve supply goes this where? The liver and the gallbladder.
Oh.
Uh-huh. Scoot forward, please. Now let's check motion of the pelvis. Watch my thumbs, feet together, open and close the knees. So what we're checking is the motion of the sacroiliac joints. They should move together. When we do one side versus the other, the opposite side should be independent. Do the right side only. So when she does the right, not a lot of action on my left finger. Left one is fine. Do the left side. But when she does the left, this thing wants to shift. So we're getting fixation right there on the right pelvis. Do you feel that? Yes, ma'am? All right, just checking. Scoot back for me, please. So we're getting the right SI joint. Right SI, you can see it's higher, riding higher on the right. Now, what we want to do is check the top of the joint. Follow my thumb here. This is the top, middle, and the bottom of the SI joint. That's where she's tender. And that makes sense with an AS pelvis. When it goes subluxates up, it's going to cause pain, irritation, swelling, and restriction on the bottom part of the joint. You feel that?
Mm-hmm.
But look when we go up top here. That's moving,
Mm-hmm.
okay?
Mm.
That's not. So, fixation, restriction, bottom posterior lateral aspect of the PSIS. That's a fancy word. You know what a PSIS is?
Mm-mm.
Posterior superior iliac spine.
Okay. I still don't know what it is.
It's the bump. It's just the name of the bump. Here.
Okay.
Okay. I call it the dimple.
I named it Henry.
I call it the dimple. These are called the official terminology is PSIS, posterior superior iliac spine.
You could address him as Henry. I'd appreciate it.
And then there's the ASIS.
What's that one?
And then there's the
Interior?
that's
See, I don't even remember
that's
school.
that one right there. Okay, now let's get to the sacrum. L5, S1, S2, S3. That's where
That's
it
fun.
is. S3.
Oh, thank you.
All right, so S3, right pelvis, T4,
Uh-huh.
left atlas. Let's check the shoulders. Da-da. I'm going to do circumduction, a little baseball style pitching.
Cool.
Checking for movement. Movement is good on this shoulder. Let's check the left side. Let me do the work. Movement is good. Go on your back. Let's check the feet. Let's check the knees. We're going to check tracking of the patella.
Okay.
So patella is formed by, we said we had some knee issues too, you fell on, so let's see what the issue is. Femur, tibia form the patellar groove. We want to make sure the tracking is good. We want to make sure there's no clicking. Okay? So forward, down, flexion, extension. Valgus varus stress, all good. Let's do valgus varus stress and extension. If it opens up more on the outside, tibia. Opens up more on the inside, femur. Tibia.
Ow! Oh, God.
So she's got a lot of gapping on the lateral aspect. There's the lateral meniscus on the backside, and if I push, there's a little bulge on the back, right?
Yeah, that's Charlie.
There, okay? Now let's do this side.
Oh, no.
Started out balling, ended up hustling.
This is the bad name. Oh.
But the tracking is decent.
Okay.
The tracking is decent. Let's do valgus varus stress. This one's worse, right there.
Oh, stop! I will.
Feel what?
Nothing.
All right, so we have bilateral posterior tibs. Predisposed, though, guess where this is predisposed from? The sacrum. So you feel the knee, I get it. You fell on it, I get it.
Yeah.
After we do your sacrum, though, you're going to tell us what the difference is.
Okay.
So
Can you physically see the? Ow.
Yeah.
Can you see? You can see the difference in the knee,
Yeah, it's swollen.
Okay.
It's rotated.
but like,
This side's not so bad.
I
It's a
mean,
little tender.
sure, but
this side,
yeah.
for shizzle.
okay. Thank you.
Yes?
Appreciate you.
Yeah?
Thank
Hey.
you.
So, talus. She's got an AS talus, medial
Oh!
tilt. That's the point tenderness. Check her out, dude. All right, jokes aside, walk it off.
Okay. Oh, so a marathon
Walk it out.
in 20 days is good.
Do you want me to talk about the sacralization?
This thing.
The sacrum?
This?
The
Yeah,
X-ray?
absolutely.
You want me to? Okay. Because what I see on you is not the same as your X-ray, dude. That's what's tripping me out. We said right pelvis, bottom right fixated, right? Correct?
Yeah. Right.
But when I look at your pelvis, your right side is dropped.
You-
It's your hip that's dropped.
Yeah. One of
Okay.
them's way higher than the other.
The left side is higher.
Yeah.
So this all came from your sacrum because you have your misalignment of your pelvis is up on the right side, but you have a tilt, you have a dropped hip on that right side. So if I fix a anterior superior pelvis on a dropped side, it's going to do what? It's going to create more gap. It's going to create more discrepancy in the hips. So what does that tell me? The answer is not there. The answer is in your sacrum on those falls.
On those falls.
Yes.
Okay.
So it's a little misleading here is what it is. And I just want to draw and measure the sacral component rotation. You want the good news?
Yeah.
You're going to be all right, girl.
Okay.
You're going to be just fine.
Is it, so this is what's causing my lower back pain?
Correct.
Okay.
Well, there's a couple things causing the low back pain. Number one is the sacrum. Number two is the pelvis. But there's something interesting we found in your x-ray that we need to talk about. There, you have what's called sacralization of L5. Now, there's two things to look at. There's a concept of sacralization and a concept of lumbarization.
Okay.
Sacralization is when the lowest lumbar, L5, takes on the characteristic of a sacrum and it kind of fuses together over time, so we have 4 true lumbars.
Okay.
Now, lumbarization is where the first sacral tubercle takes on the characteristic of the lumbar. That person appears to have 6 lumbars. Okay? Your case is the L5 is taking on the characteristics of the sacrum. So when you look at it, you can see a couple of things. This is L5. It's starting to take on the characteristics, the discs. You can see the disc here compared to these discs. But here's the more interesting part. The question is, I've had cases where we've had sacralization where there was no trauma. It was due to the birthing process and the nutritional deficiencies of the mother during pregnancy.
That sounds like Jill.
However, in your case, I don't know if that's the case because there's a lot of stuff going on in your sacrum. This should be a smooth, contiguous line. We can see a lot of these bumps here. These are old falls you had that the body was stabilizing.
Specifically on my tailbone.
Specifically on your tailbone. So where we're going to start is down on S3 today.
Okay.
S3, T4, C1 is where we're going to start. Okay?
Okay.
You ready?
Yes.
Now, there's other things going on here. That is the most significant thing we want to talk about to start working on.
Mm-hmm.
When we look at your neck, look at your neck. You have perfect discs in your neck, okay?
Thank
You do have a little bit of a straight spine. We do want a little more curve in the neck.
Okay.
That's going to come from some basic spinal flossing. There's a video we have on our channel.
What is this? What's this?
That's your earring.
Oh, cool.
That's an artifact.
Oh.
Discs are good. Otherwise, the discs are good, okay? So the main issue here is what? We need to sort out that sacrum to get you stability. We will work on the pelvis, but what I want you to know is by me working on the pelvis, what's going to happen is it's going to create more discrepancy here. So we have to start on the sacrum, bring it up, and then we can fix the pelvis.
Okay.
Sound good?
Yeah.
Do you want the truth, or do you
Yes.
want to go back to the life you were living?
I want the truth.
Let's do it. Slide out.
Okay.
Okay, turn your head to the left.
To the left.
Yes, ma'am.
To the left. To the left. Everything you own in the box to the left. I'm very scared.
You're scared of what?
I don't know. My face smushing. Ow! What the heck is that?
That was an ear adjustment. I just kind of threw that in.
Thanks. Ow! Oh my
That's
God.
a home run, lady.
Oh, you didn't even count or anything.
I don't have that luxury.
Oh gosh. That's it, right? We did it? We did it?
You okay?
Yes. Okay, what's
Shoulders
happening?
down, shoulders down.
Okay.
Down.
I like communication.
Okay, so we're going to set T4. 1, 2, 3. T5. T5, setting it as a PLS.
Oh God.
Oh, wow, you're tight.
Yeah.
You're very tight.
Did you get it though?
No.
Oh, I felt something.
No, that was Relax.
Okay.
Do I got to fix the also?
No, I like it. Oh gosh.
Gotcha. I have a couple of patients, instead of yelling, screaming, and crying, they laugh a lot. So that's good.
Uh-huh. Is
Okay.
it delirious?
Atlas was pretty intense. Walk
that the
it
neck?
out. That was the neck. Seriously. Breathe. Okay. Keep breathing. And now, all good, lady?
Mm-hmm.
Left side down, please.
Left side down.
Yes, ma'am. Bottom leg straight.
One leg straight.
Top leg bent. Slide your whole body forward. Keep going. Okay, so we're gonna be on S3 now, okay?
Okay.
Butt forward. There. You good?
Yeah.
Relax there. I'm just getting everything set up. Relax, relax. Shoulder up, 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 up. There you go. So we're gonna be down here on S3. S1, 2. She got a little tail there, you can see. And S3, I'm gonna do it as a push-pull. I need you to hook your ankle behind the knee. Straighten out the bottom leg. Straighten it out. It's okay if it goes forward a little bit. I just want it straight. The idea here is you can see now for her, this leg should be on the table. But if I put it on the table, she's in too much extension. I kind of want it flat like this for the S3, okay? So the idea is patient positioning and neutrality of the segment you're adjusting. So I'm right here, S3. Shoulder up. She's pretty flexible there. Now, we need to come through it this way, okay? Let it roll. Good.
Oh.
That was a great miss. That was a great miss. That's for the blooper reel. All right, we're thinking too much. Stop.
Okay.
Stop thinking so much,
Okay.
please. That's still not it. No,
It
that's
didn't
right
feel
too.
like it.
Let's go other side, please.
Okay.
And if I try to do her sacrum on the high-low, her feet will end up being vertical, so we don't want that. Relax this shoulder up, up, up. There it is. Good? Gotcha. Gotcha. Now, what's different in your S3, because there's a lot of callus formation in there. It's been there a while. We're going to be moving through it. It moved.
Yeah.
Stand up and walk, you'll see the difference. But we're not going to get that huge audible yet. It's going to take a few.
Okay. Ooh.
You okay?
Yeah.
Walk it off. Tell us what's different, please. No
I
good,
feel-
no bad, just different.
Just, yeah. I feel just kind of like jello-y. I don't know. It feels like lighter, airier. I don't know
Okay.
what the verbiage would be.
Can we go deeper?
Probably.
So, throat is clear. Okay, we're going to use the cervical strap for stability. Now, knees apart. Tummy down to the floor. Tummy all the way down.
Oh God, I'm scared.
Okay, you're good. Now, you can see she's a little off there. I'm right on S3. Bring this in. There we go. Oh, there it is. Good. I'm going to be over here. I'm here on S3.
Oh
Good.
God.
No, tummy down. Down, down. The more you let this hang, guess what? The easier it is, the less force. There it is. Good. Gotcha. That's it. Gotcha. 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 I got you. I got you. Don't worry. I got you. That's it.
Oh.
That's the worst of it, okay? Give me your hand. Give me your hand. I have to do it. It's okay. Are you okay? Did I hurt you bad? Just
No.
sure? Did something flash?
Oh, no.
Walk. Just walk. Just walk. It's okay. Just walk. Just walk. You're strutting now. Walk it up. Let's see the difference now. Something had to come out.
Yeah.
You're okay though,
I'm
right?
okay, yeah.
Get over here. Get over here. Let's watch. Okay, walk. Es muy diferente. Okay, on your back. Actually, let's scope you first. Let's re-scope. Have a seat. Told you something needed to come out. Seriously. So can you tell me what happened there? Can you tell us what happened? Did you get hurt? Did something just come out? You just
No.
had a sudden release of something?
Yeah, I mean, it's not like a pain at hurt. It's like it's like a release. And then I think it's just been like built up for so long.
Correct.
And I don't think I've ever been able to feel a release there.
Okay. Did you feel the release today?
Yeah.
Okay. Neck is clear?
My neck's clear? Oh, because you did it earlier.
Yeah. G5 is clear?
I still feel it.
Yeah. But watch this now. You want to see them scoot forward? It's going to be like the Matrix now. Watch this. All the way back. Do it again. You feel that?
Nothing.
Right?
Yeah, it's fine.
All right. Scoot back for me, please. Shoulders are fine, we said. We're going to work on your knee. On your back, please. I'm gonna just start the knee process. I'm not gonna go aggressive on it because we did a pretty deep set on your sacrum.
Okay.
That's gonna affect the mechanics of everything.
Okay.
Go on your back though. I wanna just humor me for a second. I'm gonna do that valgus varus stress. I'm sure something changed. Go on your back.
Okay.
Check it out. Check it out, Johnny. Valgus varus stress was opening a lot on the outside. Tell us.
Yeah, it doesn't hurt like it did. I was gonna punch you earlier.
Yep. Check it out.
Okay, this was the really bad one.
I know. I mean, it's still tender, but watch.
That's crazy.
Okay?
It doesn't hurt.
Got it. That was all sacrum. Now, we're going to just lightly set the tibia with the board
Okay.
just to get it moving on the back. I'm on the back side of the posterior lateral capsule. Relax the knee. That's it.
It's just scary. It doesn't hurt or
Ankle.
anything. Yeah, it doesn't hurt.
Ankle.
I always thought this would hurt.
Stand up.
You didn't want to do this.
It's a Hollywood, girl. Squeeze. Squeeze. No, I don't want to.
Ah! Okay. It's just shocking. Don't get mad. It's shocking. It doesn't hurt. It's just shocking. Ah, okay.
I don't. Easy.
It's just, sorry.
Timber wolf. You a timber wolf?
No, I'm a twin.
Oh, twin.
The Twinkies.
Okay, relax. There. Squeeze. Relax.
Okay.
That's it. Okay. One more on the thumb.
Okay.
Squeeze. Let's go do your nose. On your back. So you got a nice deviated septum. We're going to start the process.
How do you know that?
It goes like that. Look, it's like, wah. Get over here.
What?
Wah. Correct? Yes? He's being
He
very good.
thinks it's beautiful.
He's being very good. On your busy.
Okay.
Slide up. So it's curving this way. High side of the rainbow is on the left side, so we're going to come in from the left side.
Oh, gosh.
Still Rahim, my name, okay? Okay, so we're going to come in, we're going to take the nose all the way over. We're going to set it that way.
Oof.
You okay?
Yeah. Oh, gosh.
That was a home run. Dude, that's set. Awesome.
Oh.
Nice. There was an audible on that one. Seriously. Walk and talk.
That's crazy.
Walk and talk. I just gave you a $5,000 nose job. You're
Ooh.
welcome.
My sister's
You're
gonna be
welcome.
so jealous.
You're welcome.
Thank you.
You're welcome.
Thank you.
Now get a close up of the nose so we can do a before after.
What?
It changed already.
Really?
It's not 100%, but it changed already. Cool. Right, sir? It changed a little bit. All right. Squeeze. Squeeze. Tiny bit left on the scaphoid. Got it. Squeeze. Squeeze. It changed. You're all set.
Yeah.
Welcome to the office.
Thank you.
Questions?
No.
Okay, see you in a couple of days.
Okay, thank you.